What is blockchain technology, and how can it make my life better as a physician? How do we fix the onerous credentialing process? How do we reclaim our physician-related and patient-related data? Learn the answers to these questions and many more on this episode of the Talk to Me Doc podcast.
Welcome to the Talk to Me Doc podcast, where it's all about serving the early career physician. Let's talk about the unique issues that face us so we can create a better future for ourselves and those to come. And now your host, Dr. Andrew Tisser.
Hey guys, it's Andrew. Welcome back to the Talk to Me Doc podcast. I'm so happy that you can be here with me today. For our new listeners, thank you so much. For our returning listeners, I really appreciate your continued interest, because today, like on every episode, I'm bringing you the best guests from all around healthcare to discuss the issues relating to the early career physician and how we can fix them. Today's guest is a real treat. I'm sure you've seen her work if you're on social media at all. Today, we're bringing to the show Dr. Leah Houston. Leah Houston is the CEO and founder of HPEC. While practicing emergency medicine across the U.S. for nearly 10 years, she recognized a common problem. Uncompensated administrative burdens related to physician employment and credentialing are a leading cause of administrative waste and physician burnout. She realized that self-sovereign identity technology could be applied to alleviate this problem by allowing physicians to be the single source of verifiable truth about their professional identity and credentials. HPEC will streamline the current antiquated and laborious process of credentialing, reduce administrative waste, improve access to care, and give physicians sovereign ownership of their data and employment rights. HPEC identities also create an opportunity for physicians to communicate with each other more efficiently in order to improve patient care. The technology will also allow patients to interact directly with their physicians, which will restore agency, privacy, and autonomy to the physician-patient relationship. In presenting a solution that has the potential to alleviate the administrative waste for health systems, government, and practicing physicians, she is recognized and requested national speaker on the topic of decentralized identity as it relates to healthcare. Her work was featured as a part of the first HIMSS Blockchain and Healthcare textbook. A lifelong advocate, innovator, and investor, she has also spent lobbying for public policy and healthcare reform. She understands the problems that plague the healthcare system and understands how this revolutionary new technology can help. Well, if you're not excited by now, I don't know what's wrong with you. Let's welcome Dr. Houston onto the show. Leah Houston, welcome to the Talk to Me Doc podcast.
Thanks for having me, Andrew. I appreciate it.
Oh, thank you. I've been seeing your name pop up everywhere on social media lately, so I'm happy to be able to host you.
Yeah, no, thank you. I'm glad to hear you're seeing us out there. We're definitely trying to get the word out as much as we can. So sounds like it might be working.
I think so, or maybe just within our circles. But I recorded a little intro about you to the audience. But in your own words, could you give us a little spiel about who you are, what you do, and what your role is in healthcare?
Yeah, so I'm an emergency physician. I graduated from residency in 2012 from Albany Med. And I was just trying to be a boots on the ground doc, taking care of patients. And, I also did some investing on the side, some day trading, some real estate investing. And I'd learned about this technology and I was kind of paying attention to it, reading white papers. I invested a little bit in the blockchain space. But then a hospital stole my identity. And that experience led me to realize a very real opportunity with this technology and how we could have potentially prevented that from happening, but also to do a lot of other things to fix this broken healthcare system.
Yeah. Well, first of all, shout out to Albany Med. My wife trained there for internal medicine. But so we know the place very well. But can you expand a little bit more on the technology that you're referring to? And I know some of it gets a little mysterious for some people.
Right. And it's tough not to get into the weeds on this. But essentially, the way that we used to do things was the analog way. We only had paper and faxes and things like that. And then the internet came along. And the internet was allowing us to do a lot of things. Now we can deposit checks in the bank with the internet, call a car from our phone, connect with people from across the globe. It's really an amazing opportunity that's come about. But if we think about it, the current version of the internet really doesn't create an opportunity for direct communication, because in order for any of these communications to happen, somebody has to have built a centralized system. So, for example, our social media platforms that are out there are owned and controlled by private companies, and they control and own the algorithms, and they could delete you if they wanted to. We heard recently with what's going on with Trump and Twitter and that disagreement, them putting a fact checker on, that was a decision by a private company that they are allowed to make because it's their company. Now, whether it's meddling in the elections, that's another question. But, also when you talk about your banking transactions, the bank really is owning and controlling these transactions. So even though it's FDIC insured, if the government goes in and tells them to shut your bank account down, they'll do it because they have to do as they're told, and because it's a centralized platform that they do have control over. And so when you think about distributed ledger technology or blockchain, it provides an opportunity for decentralized connections and communications and data transfer between individuals without the need for a centralized server. And so that means that it's through the cryptographic code that's designed and built that we are allowed to make connections and transfers. And so with the Bitcoin blockchain, you are allowed to transfer a Bitcoin from one person to another without having to go through that third party system that's built by somebody, by a single entity. And so people got really excited about that because, essentially it's an opportunity for exchanging value without it being tied to the US dollar, to the Federal Reserve, or to any other, source of fiat currency. And so the thing that's really interesting about blockchain is it's not only for the transfer of digital currency or cryptocurrency, it can be used for the transfer of any digital asset. And to think about it, anything in the tangible world could be made digital. So for example, a title to your home, a title to your car, your birth certificate, your driver's license, all of these things can now be digitized and put in an individual's wallet that only they own and control. And that's called self-sovereign identity technology. And that's the technology that we are building with HPAC.
Okay. Well, so if your regular in the trenches doc comes to you and says, well, okay, I think I get it, but how is that going to help me in my day-to-day? What are you hoping to accomplish?
Well, it depends on what the pain point of that day-to-day doc is, because this has the potential to solve a lot of pain points. But our first use case is to tackle the onerous and administratively burdensome credentialing process. For those listening who are not physicians, this process of credentialing for a new job takes the doctor anywhere from 2 to 6 months. And it's a very paperwork heavy process where, somebody in the HR department somewhere is calling every single place you went to medical school, residency, licensed, your DEAs, faxing forms, requesting proof of verification that you are who you say you are. And they do this to keep everybody safe and to make sure that, you're not a criminal or a negligent doctor who's had a lot of lawsuits. But this technology provides an opportunity for you as the individual to be the primary source of verified truth of these credentials. Because at the time the credential is issued, they can issue it to you in digital format, put it in your digital wallet, while also writing proof that that credential is issued onto a blockchain. And that way, whenever you present that credential, whether it be your medical license or your DEA number, the person can look at your credential, look at the blockchain, make sure they match, and then allow you to move forward. So this will turn the 2 to 6 month process of credentialing into an instantaneous experience, saving billions of dollars a year.
Yeah, that's huge. I mean, especially for us ER docs that oftentimes work at multiple facilities, for our colleagues that work in locums and are moving around all the time. I mean, this process is really horrible, quite frankly. So, and from my understanding of blockchain, it's very, very challenging to tamper that, because you'd have to go in and change every block within the chain to make any kind of subtle changes. Is that correct?
Absolutely. So the thing that makes blockchain possible are the fact that it is, number one, distributed onto thousands of computers. So every single transaction is copied immediately onto thousands of computers. And these computers are being watched by people who are being paid to watch them and to make sure that they're accurate. And if they make it inaccurate, then essentially the value of what they're being paid will be worthless. So that's the first one. And the second one is the immutability of the record. Before you're allowed to put a new transaction on the ledger, you need to first check and make sure that the previous block of transactions are the same on all of these computers. So it creates a way for us to essentially create a trusted system without the need for a centralized authority being the only one that's looking at these and making sure that they're accurate. We have the trust of thousands of computers and thousands of nodes across the world, of people who have aligned incentives to keeping the integrity of the system in place. And so that's the difference in how digital assets are distributed and trusted in these systems versus the old internet systems.
Yeah, that's pretty impressive. I mean, one of the core tenets of this show is team-based communication. And honestly, when you're going through the credentialing process, just tracking down one piece of paper could hold up your application for months. Unlike our nursing colleagues that oftentimes can go start a new job within a week or two, we really struggle with the credentialing process. So that's huge. Are there any other applications that you're working on right now? Or are you focusing on credentialing?
Well, in my opinion, the credentialing and identity problem is the first problem that needs to be solved in order to do all of the other things. And so what do I mean by that? So right now, the United States government, the Department of Health and Human Services, recently put out a regulation called the 21st Century Cures Act. And that regulation requires institutions who hold health records of our patients to comply with information blocking statutes and forces them to become interoperable. So essentially, they're going to penalize anyone who doesn't have health record systems that are interoperable, and they're going to penalize people who are blocking information from being shared with the patients. It's basically making the patient record is supposed to be that of the patients, not the institutions. And so this is a really groundbreaking, act that was put into place. And in order to create that system in the future, in my opinion, we're going to need self-sovereign systems. So in order for the patient to own and control their record, they need to have a self-sovereign identity that's attached to that record in some way, where they can easily be the source of truth regarding their health records. And if you think about it, because we as the physicians are the ones that document these records, when you get surgery, the surgeon leaves the OR and he dictates what happened in the surgery. That's part of your medical record. When you get an X-ray, it's the radiologist who dictates the results of that X-ray. When you go to the ER and you have a laceration repaired, it's the emergency physician who documents the size of the incision, or not the incision, but the size of the repair and how they repaired it and what they talked to you about. So it is the physicians who really control these records right now, but we're being forced to give them up to these centralized electronic health record systems platforms. We're essentially being forced to give away our patients' protected health information. And what many of us don't realize is that these systems are de-identifying that data and bundling it and selling it to whoever wants it. So they're monitoring our patients' behaviors, they're monitoring our behaviors. And if we look at the cost of healthcare that went from $3.2 trillion to $3.6 trillion this year, we will now realize that they're using data analytics on this data in order to try to find out ways to deny services to patients while denying payment to doctors. And that's why we're seeing a problem with prior authorizations and surprise billing. So in my opinion, in order to comply with the 21st Century Cures Act, we need to build self-sovereign systems for the future for both doctors and patients. And it's upon that on which everything else can be built. And it will allow a future where patients and doctors can connect and interact directly without having to risk this personal data, protected health data breach that's happening essentially every day we click send on our EHRs.
Yeah, that's a pretty powerful statement. I think that's addressing a lot of the issues right now that we're facing, whether that be insurance control, physician autonomy, increased regulation, EHR issues. I think that's also, a lot. We talk about physician burnout on the show a lot, especially as it relates to the early career doc. And I think the technology has a lot of promise for mitigating a lot of the issues that we're dealing with that cause some of this burnout that we're seeing.
Absolutely. And I mean, the EHR is a huge source of burnout for practicing docs. We're spending hours clicking meaningless metrics that don't concern us at all. This is just data that they're gathering. And they're taking in, they're using it against us. So why would we continue to use these systems that are directly harming our patients and also harming us and leading to burnout and the physician suicide problem? That's a big problem. Physicians have the highest suicide rate of any profession. And, it's not just the credentialing problem that burns us out. It's every day as we click the EHRs, it's also burning us out. And I think patients are also sick of it too. So, there's people in the system, also, ancillary staff who uses EHR, they also don't like it. The nurses don't like it. So we're using systems that are really not made for us or our patients, and they're actually harming good.
Yeah, the EHR at its core is a cash register. It's a billing platform. It's not a medical documentation platform. It's not designed by us, and it is not user friendly to us. Even the best ones, I think a happy or less stressed out physician will always trickle down to better interpersonal issues at work as well. Some doc who's been so burnt by the system it's a struggle to see every next patient is not going to have a great working relationship with his team either. Right. So I think what you're doing is pretty important.
Absolutely. Thank you. I appreciate that. Also, we have to think about this. And for those of you who are listening who like to get the data from these systems are not providing accurate records. Almost every single time I've ever looked at these systems, there's inaccuracies throughout them. We have hypertension documented twice as HTN and hypertension. We have incorrect med lists. We have misdiagnoses in there. And this is because the physician and the patient are not the single point of control of this record. The patient should have a right to dispute the things in their chart if they don't agree with them. Mistakes are made all the time. We're rushing around. And so these mistakes are just perpetuated repetitively through these record systems, and they're not valuable.
True. So how can docs get involved if they like what you're doing and they want to help?
So we're doing something very unique. For the first time in history, we have built a company that aims to restore physician autonomy, and it aims to restore privacy to the doctor-patient relationship again. That is the mission of this company, and that is its sole purpose. And we aim to do that through these self-sovereign identity technologies. And so what we've done is we've taken advantage of the 2016 Jobs Act, and we have been accepted to a crowdfunding portal where any physician can become an owner in this new future that we're building. And the way you do so is you go through the crowdfunding portal and you can invest, and you can, purchase stock in this company and essentially help, be one of the first people to own and design your future. And when you come to our crowdfunding portal and you invest as a doctor, you're not only giving yourself the potential of having this for yourself, you're not only giving yourself the opportunity of, building the future that you can be proud of, but we plan to give these identities away for free to the physician community. So those of you who aren't able to participate and become an investor on the platform, you will be getting these identities for free. And this is a gift that we're giving to the physician-patient community so that we can restore autonomy to the doctor-patient relationship. And I want to let everybody know that, I hope people realize the potential value of this. They think of the, tens of, thousands of dollars that they've spent on credentialing and licensing and employment contract reviews and maintenance of certification and all these things. And we aim to address all of these. So when you decide to invest, think about that number. But just to let everybody know, the minimum investment is only $250. So anybody can really become a part of this. And that's what's really exciting about it.
Hey, even a resident can scrap together $250,
Exactly. And that's why we chose that as a minimum, we thought about making the minimum $1,000 because of the tremendous value that it brings. But we also said, a lot of people aren't able to do that. And we want even medical students to be able to come in if they believe in this. And if you believe in this, you believe in a future that's better, a future where physicians and patients have privacy, a future where doctors are free to move and change jobs without being restricted by these, onerous credentialing processes, and a future where we can also do many other things potentially with these identities, including, improving the payment system, data analytics, providing care to individuals in our communities that need us in a streamlined way. We can make ourselves available for volunteer work. We can support our physician colleagues when they're having, when they have new ideas. We can help them incubate their ideas. We can, push publications out that are written and designed by the physician community. We can influence policy that, can help our practice and our patients. There's just so many other things that we can do with this, and it's really exciting.
Yeah, absolutely. No, that's great. Well, let's shift the show a little bit just to get you to know you a little bit better. What do you like to do for fun?
Work. I'm just joking. I love the outdoors. I love hiking. I love biking. I've been kind of an outdoorsy girl in my whole life. I like to go camping. I like to go to the beach, spend time with friends, not during the coronavirus situation, but now we do Zoom calls, so it's fine.
Yeah, I mean, Zoom calls are still, I feel like I'm connected with more people than I was before with just these like big Zoom parties that people are having,
Yeah,
that's
great.
Yeah, it is fun. So do you have any book recommendations for the listeners?
Oh, wow. Business or pleasure?
How about one of each?
Wow. Well, so I've been reading a lot about, business. I've read recently Pitch Perfect, which was really helpful in how I discuss what we're doing with others. But one of my favorite, for fun books, I'm kind of a time travel nerd. I like time travel movies. I like thoughts about time travel. And so there's a book called Replay, where a guy basically dies at the age of 40, but then wakes up at the age of 18 and he remembers his previous lives. So he's able to live his life moving forward as if he had gained all of the knowledge from his previous life. And it's a really interesting book. I liked that recently. That was one of my pleasure books I read.
Yeah, that sounds good. I like that. I feel like a lot of ER docs like sci-fi type books for whatever reason. I don't know why.
We're nerds.
I guess. No, we're cowboys. Come on.
Yeah, that's that too.
Well, if you could give early career physicians a single piece of advice when it comes to their careers going forward, what do you think that would be?
If it feels wrong in your heart, it probably is. And don't let non-physician administrators tell you otherwise. Find your tribe of people who you trust, who you can talk to about whatever it is, and get yourself out of the situations that are not safe or appropriate for you or your patients. We as physicians right now are, they're often pushing the boundaries, the ethical boundaries with us regarding protocols that we have to follow. And, I experienced this in residency because I was training during a period where pain was the fifth vital sign. And we were essentially, Albany Med was really great about this because they were very careful about how they taught us. But essentially, we were being told if somebody's in pain, you have to give them opiates, because if you don't give them opiates, you're not treating this pain problem. And now fast forward, and we're not allowed to give opiates to anybody. Everybody just gets Tylenol, maybe Tramadol. And it's just a demonstration of the dangers of the corporate government practice of medicine. We as physicians know what's right for our patients. Both extremes are wrong and both extremes are bad. And whenever we're improperly incentivized, we have the current problems like we currently have now with pain patients that are dying by suicide because they're unable to get, the opiates that they were on for years. They're dependent on them and they can't get them. And then, we have this, very low number of people of society who do abuse these drugs, who now have had increased access because of this. And so, when I was in training, there were several docs that spoke up about this, and they were essentially told, you're wrong, be quiet, we have to follow these protocols. And they knew in their heart that they were right. And I was given the chance to hear their opinion because they spoke up, and it helped to shape my practice. So don't ever stifle that voice. Listen to that voice and talk about it, and find the people that you need to talk to get through those kinds of issues.
Yeah, that's great advice. So if people want to learn more about you or connect, where can they find you?
So we're all over social media. I'm on Twitter a lot. Tweet to me, send me a direct message. I'm there. I love to answer questions. I love to, hear from people what they think about this. So my handle is @Leah Houston MD across all platforms, but Twitter is where I usually respond. Our website is hpec.io. That's HPEC, and that stands for the Humanitarian Physicians Empowerment Community.io. And then we are also on social media at HPEC ID across all platforms too. And so we're also, if you sign up on our website to learn more, you can follow us on our crowdfunding page without investing, just to kind of keep track of what we're doing. And we also do Zoom calls. So if you're signed up on our website, to join the waiting list and to join the newsletter, you're going to hear about those as well. And we can, meet face to face one day soon.
Awesome. Great. Well, thank you again for coming on the show and sharing your company's mission and doing your part to help healthcare. Myself and everyone else who's listening really appreciate it.
No, I appreciate what you're doing, Andrew. What you're doing with this platform is really powerful and important. And I'm really grateful that you invited me to come on, and I'm grateful to everyone who's listening.
Oh, thanks for saying that. Well, we'll talk soon.
All right. Take care, everyone.
Bye-bye. What an amazing episode with Dr. Houston. I really learned a lot. I had a basic knowledge of blockchain, but she really broke it down to make sense of what it is and how it can help us. She talks about how blockchain can be used for the transfer of any digital asset, not just Bitcoin. She talks about how HPEC's first use will be to fix the onerous credentialing process. And if you've ever worked in multiple facilities or as a locum tenens, you can understand how crazy it is. Dr. Houston talks about how physicians are currently being forced to give away patient information to centralized electronic health record systems. And these systems are using data analytics in order to try and find out ways to deny services to patients while denying payments to doctors. Horrible. And that's why we're seeing a problem with prior authorizations and surprise billing, etc. She talks about how HPEC aims to restore patient-physician autonomy and privacy. Well, I know that I certainly will be looking more into HPEC and all the exciting things they are going to do. That's all we have for today, guys. Thank you so much for listening. If you liked this episode, or if you didn't, please leave me an honest review on Apple Podcasts. It helps get our show out there to help more physicians and other healthcare personnel. I can always be reached by email or on social media, usually under Talk to Me Doc. Until next time, guys, keep talking. All opinions expressed by the guest in this episode are solely the guest's opinions and do not reflect the opinions of Andrew Tisser DO, Talk to Me Doc LLC, or any affiliates thereof. The guest's opinions are based upon information he or she considers reliable, but Andrew Tisser DO, Talk to Me Doc LLC, nor any affiliates thereof warrant its completeness or accuracy. The guest, Andrew Tisser DO, Talk to Me Doc LLC, or any affiliates thereof are not under any obligation to update or correct any information provided in this episode. The guest statements and opinions are subject to change without notice.